Hi, good evening. Very often you see these headlines in the newspapers. Is screen time making our kids fat? Is screen time making us stupid? Children are battling anxiety and depression. How can parents shape their children's mental health? Today, we are going to be looking for some of the truths behind these on Insight with our special guest, Dr. Avinash De Sousa. Dr. De Sousa is a consultant psychiatrist and psychotherapist with a private practice in Mumbai. He has over 300 publications in national and international journals. He's one of the few psychiatrists who, in addition to a psychiatric degree, has an MBA in human resource development, a master's in psychotherapy and counseling, and an MPhil in psychology. He's also the editor of a journal called Indian Journal of Mental Health. Welcome to our show, Dr. Avinash.
Thank you. Good evening. It's a pleasure to be here.
Okay, so we'll start. A growing proportion of our children and adolescents' leisure time is, as you know, is spent with screens, including smartphones, tablets, gaming consoles, television. This has raised concerns about the effect of screen time on the well-being among parents, health professionals, and educators. So we want to know from you, doctor, what are your thoughts on association between screen time and psychological well-being among children and adolescents?
Well, I think what parents have to realize and all of us have to realize is that this is a very unprecedented kind of period because we've never really had a time where children haven't gone to school. We've never really had a time where education has come home. So we are forced, rather, and left with no choice but to have online schooling.
Right.
So, if we complain about the fact that the child is spending probably 4 to 6 hours on an average in an online schooling class, and following that, he also wishes to play on his gadget because he uses it for recreation, it's bound to happen because what are the other outlets for him? We aren't allowing them to go to parks, we aren't allowing them to go down. Now, with the lockdown being eased, some facilities have opened, but the risk of COVID still remains. So we are being very careful. And what has also happened is that, uh, let's say, even if the child didn't have to use his laptop or iPad and the school provided him with an independent gadget for online schooling, we would still have screen time which is increased. Now, what people have to understand is there are two facets for screen time. There's something known as a work screen time and there's something known as a recreational screen time. So if we have children who are on in school and doing school work, or let's say we have an IT professional who's doing his IT work, that's part of its job. Similarly, schooling is part of the job that children do. So we can't really regard that as excessive screen time,
Right.
but it's the recreational screen time that worries us. That okay, 5 hours of school on an average, 4 hours on an average, followed by 4 hours of recreation. Now ideally you would have only had 2 or 3 hours or 4 hours of recreation and you wouldn't have had. So it's been this 1 year where we are seeing this change. And I'm very sure that the moment the pandemic phase is over and children go back to school, we will no longer have this extra screen time period. So we're going to probably have just the recreational screen time, and the child will be in school probably from 9 to 4 or 7 to 1. So anyway, he won't be having access to screens. So it's very important for parents to realize that this is an intermittent period. It's an adjustment that we are making. Yes, we have to be particular that we protect our children's eyes. So make sure they sit properly, make sure that there is not too much of glare on the screen, make sure that they wear glasses if they have to, or if they have been already advised glasses by their doctor. Make sure that they aren't on multiple screens at the same time, because very often I've seen many children who are on a gadget, they tend to shift between the internet and online school because they get probably bored of what's probably happening in the class, or they are chatting with their friends at the same time. This is something which we shouldn't allow, and try and sort of rather let them focus on what's happening in the classroom. So this is something which I feel is very, very important. And what's also important for parents to realize is that the school has come home. So you have only this option right now. I mean, when
Exactly.
people tell me we don't, online schooling takes a toll, so I always ask them, what are your other options? If let's say it's going to be a pre-recorded class, you're still going to see it, so you're
Right.
still going to probably use the screen. So
Right.
there's no way you're going to escape the screen medium. So I think parents and children and adults have to realize that this is a 1 year, 1.5 year period where we are making these adjustments for our own safety,
Right.
and we have to adapt. I think we've all adapted to the digital medium very well, like we never have before. And I think we children also will adapt.
Right.
And yes.
So, can we quantify like how much pre-play screen time should a child have on top of the remote learning, or not really? Uh,
Okay, yes, I have been asked this question many times, and it's a very difficult question to answer, because I mean, on an average, if you ask me, children spend 4 hours additionally other than school on their screens. Now, uh, again, here is the catch, that very often they say we have to keep using our gadgets because all our homework, assignments, submissions, etc., are happening online.
right.
Notes are being sent online, PowerPoints are being sent online. We have to copy notes from an online medium to our notebook. So, again, the screen time increases that way. Apart from that, yes, there is gaming that happens, there is chatting that happens, there are Zoom meetings with friends that happen. Now,
Those are important.
those are essential, those are essential, because the child has to have recreation. Now, he's not actually going down and playing cricket in a building, he's
Right.
not going to a playground, he's not going for a walk. So, and with the kind of, I would say, uh, I would dare say, callous disregard for social distancing, it's all the more difficult to send children out in today's scenario. So it's, even in a mall, you never know what infection he's going to catch. So it's very difficult to probably send the child out and maintain all the protection that we want. So he's bound to use the screen, or he's going to see a movie. I mean, he would want to relax at the end of the day. So it's perfectly fine. I think the only thing that we need to realize is that he shouldn't probably be 10, 12, 14 hours on a gadget totally, including school, which then can be something sometimes detrimental. So we just adapt for the current period.
Yeah, okay. So get it. So, we know that there's so much written about screen, the way it's affecting us, because we just discussed that kids are spending a lot of time, and it's important to understand the impact it is on us. So there are times when the screens actually do cause problems, like when children, during regular times when they don't really sleep on time and they don't want to go down for any kind of physical activities. So can you tell us, in normal circumstances, when do screens cause problems?
Well, I think there are few rules that even in the current scenario and in normal circumstances, both have to be followed. The gadget is not to be the first thing the child goes to early morning,
Okay.
except, of course, yes, he would probably get up, brush his teeth, have his breakfast, get ready, and then he'll put on his gadget for school. But he shouldn't lie down in bed early morning with the gadget. That's very important.
Of course.
Similarly, the child should probably be gadget free for an hour prior to sleep, so that he can sleep
Sleep well.
easily and well, and his eyes get rest so that he sleeps off well. So
Right.
that's something which is, and the screen glare does not affect his night sleep. So that's something which I think is important. No gadgets while they're consuming food. We have to be very particular about that, because I don't want them to see a screen and eat without being
Most of the
mindful of,
children,
yes,
especially teenagers, do that.
yes, and be non-mindful of what they are eating. So that is something which is, I think, vital. And a very very important facet is, yes, you can't have the child you know get up, have a gadget at 11 p.m. and then be awake till 2 a.m.
Yeah.
when he has school again at 8 a.m. the next morning. So one has to be particular about those things. And it's also very important that his communication with family members has to be verbal and not via a family social media chat. So make sure that he's chatting with parents, actually he's putting away his gadgets, sitting with you and chatting rather than just texting. So I think that is something which we have to, I think, have ground rules for.
That's important. Absolutely. Yeah, because sometimes I do see these teenagers, they just, WhatsApp their parents that as to where they are and where they are going. And yeah, so yeah, they
No,
should.
they even WhatsApp their parents from the neighboring room, is the
Yeah,
dinner ready? Can you send me a glass of water? I mean, these things, shouldn't really happen. I mean, they have to learn to communicate physically, verbally.
okay. So, doctor, many parents are exasperated by their child's constant technology use, and they want to know from you a few basic parenting guidelines that can help parents establish some ground rules and maintain tech harmony at home. You've already just kind of
Yes, but
told
but
us.
I think what's very important is there are two aspects to this. One is the rationality of the usage, and the second is protection. So the rationality of the usage is that no use early morning, no use before sleeping, no late night usage, digital free hours where the entire family puts away their gadgets and sits and talks and
Okay.
has a meal together probably. Also, wherein you have to have a few hours in the afternoon where the child is gadget free so that his eyes get the rest that it deserves. So that's the more rational aspect of the usage. The more protection aspect of the usage is we have to teach them proper netiquette, the way they have to communicate online, the kind of words they use online, the kind of comments they pass online, the sort of chats that they have with their friends have to be, I would say, parliamentary rather than unparliamentary. It's very important that we also teach them that you do not share personal information with people who you don't know. You do not share pics with friends who you don't trust. You do not probably divulge personal family information to friends who you're not really aware about. So these are things which are very important. And even on gaming platforms, when you probably are into online gaming and you meet strangers, please do
Mhm.
not divulge personal information. It's very, very important. And the most important thing parents have to teach children, two things I think, is you never meet anyone offline when you've only met them online. So that's something which is there. And the second thing is, if you ever feel you're troubled, stalked, bothered, bullied, upset, trolled, etc. by anyone online, please inform an elder or a parent immediately. Do not get afraid that the internet privileges will be withdrawn. Rather, we may be in a better position to help you, and that's important.
That's a very good point that you've made. Yeah. Okay. So, doctor, now that we know that children are, consuming technology passively, they're watching TV, they're listening to music, but there's some interactive consumption also happening when they're playing games and they're browsing the net or they're video chatting. So, I want to know from you, do you think we should be making a distinction between different kinds of screen time? So, like choosing high quality media, should there be a distinction?
Well, I think there should be a distinction when we're choosing media, because the kind of games they play, the kind of internet usage they have, the sites they visit are very, very important. You have to keep track of, what they are seeing, what they are doing. And this is vital, because, very often they visit sites which are meant for adults. They visit pornographic sites. They're playing games which are violent and extremely bloody in nature. It also happens that they are onto platforms for chat which are adult platforms, and they are chatting with adults though they are underage. So these are things which I think you'll have to be very, very important. And I think a very important message that goes, Facebook normally says that you have to be at least 14 or 16 before you can have a Facebook account, and more than 10 million users worldwide on Facebook are below age 11. So that is something which one has to be quite alarmed about. It's also very important to know that there are many people who uh, the largest consumers of pornography are children between the age of 8 and 13. So that's also
Really?
something. Yes, 8 and 13. So lot of people, and pornography is rampant. I mean, 12% of the internet is pornography. So we have to be very careful about what our children are seeing online and what they are. There is a humorous quote that parents are always worried about what their sons are downloading and what their daughters are uploading. So we have to be very particular about what children are doing online.
Right. Okay. So, in today's tech and media driven world, we've seen many parents, they use screens to keep young children entertained or distracted while they're juggling other needs. So, babies under two, we've seen are really adept at swiping the screens and tapping, etc. So, the question is, what's the best way to start introducing a 2-year-old to screens?
Well, I think when you introduce a 2-year-old to screens, What's very important is that you have to maintain the right sort of balance. Make sure what kind of sort of gadgets are you introducing him to, because you sometimes can probably cause a problem if you introduce him to a screen rather than physically being with the child. And very often lot of people sometimes then um, uh, think that the Samsung or the iPad is a substitution for parenting. It isn't. It's a substitution for caregiving. It isn't. So you don't just put nursery rhymes on and let the child be alone. You have to sit there
Sit
and
around.
sing the nursery rhymes with him. Similarly, you do not just expose the child to cartoons and leave the child alone to laugh. You have to be there, talk to the child, explain to the child what's happening. The child cannot learn sound, phonics, language from an iPad. He has to learn it from a parent. The child can't be conditioned to using an iPad to go to sleep. You have to sing and lullaby your child to sleep. So
Right.
that is something which parents don't do. I always remember a very funny incident, that I was in a mall and on an escalator, and there was a small baby that started crying, and immediately the father said, mobile nikalo, mobile nikalo. And they removed the mobile and they played some particular song, and the baby must have been 9 months old or 10 months old, and the baby stopped crying. And the father, I was looking very intently at the father, and he told me ki ये इनका favorite gana. I said, how do you know? Did he tell you? So he said, no. He said, the thing is, when we play this song, he eats. When he play this song, he sleeps. So we ourselves are digitally conditioning children from a young age.
Right. Right. Okay. So we do know now that the technology is here to stay, and the world is becoming more digitally driven. So maybe a balanced relationship with technology works the best. So we are now going to move away from digital online learning, and I want to talk to you about mental illness among children and adolescents, which seems to be increasing. So from the data that I've got, it's about 10 to 20% of worldwide children, they experience some disorder that interferes with their daily life. So the doctor, I want you to tell us, what is mental illness. We'll begin with that, and then I have a list of questions that our viewers wanted to ask you.
Well, it's a very, very broad term. So if you look at
Okay.
mental illness, it can be of various forms, right? From just very basic anxiety, feeling scared, to
Okay.
depression, to feeling low, to getting upset or angry, particularly from a child's perspective. And it could even be a very serious disorder related to some trauma that the child has undergone. And what you're saying is very true, that 20 to 30% of children do suffer from some problem, because even when I work in schools and I walk into a classroom, in, let's say, a primary school classroom, you have around 10 to 20% of children who are hyperactive, and
Right.
hyperactivity is a problem. So it's definitely a psychological and a psychiatric problem that needs help. So we see that. Similarly, when we walk into an adolescent school, adolescent classroom, we have children with with anxiety, we have children with depression, we have children with conduct problems. So again, 10 to 20% of children have an issue.
Right. So, doctor, but identifying these mental disorders or conditions in children can be really tricky for healthcare professionals, isn't it? Because children experience physical, mental, and emotional changes as they progress through their natural growth and development. So, how do you actually get to know that your child may have some mental health issues?
Okay, now a very important facet to understand is that there are huge variants in normal child and adolescent development.
Right.
So the variation grid is quite wide, and we have to understand that there are a lot of normalcies that fall within the rubric of child and adolescent development. So what's also important, and I would say very, very important to follow, is that you probably will have uh, children who do not appear psychologically ill but are. You will have children who appear but aren't. So you will
Okay.
have that kind of a picture very often. The
Mhm.
key thing is, a detailed history is very important, a detailed assessment is very important, a detailed psychological evaluation is very important, detailed uh, assessment, even by a detailed sort of interview of the teacher, because she's seeing the child for nearly 6 to 8 hours a day, is also very important. So that gives you a very important picture. Now, a common thing I remember when I work in schools is, very often there are children who are referred to me for mischievous behavior. So I remember when I used to visit a school as a counselor. Now I go as a psychiatrist, but when in my early years, when I used to visit schools as a counselor, I would be sent a number of children that, okay, the child is throwing chalk on the teacher, or the child is throwing paper balls in the class, kindly refer to the counselor. And I would normally diagnose it as normal teenage behavior and send it back. And they would very often be unhappy that, we aren't really doing anything behaviorally. So what's very important to understand is that making noise in the class, or whistling, or all these behaviors are very normal. We can't put these children as conduct issues. Conduct issues are when he back answers, hit someone, has no regard for the teacher. Even the teacher probably is sort of back answered in such a way that it's insulting. There is a vengeance. There's a huge aggression quotient. There's so many factors that play a role. And I always tell all my teachers that look for the child who's quiet and alone and aloof. He's the child that needs help more than the child who's mischievous. So that's something which I think you have to go with. So there are huge variants. Detailed assessment is the key.
Okay. So, what causes these mental issues in children, doctor? Are there certain risk factors?
Yes, there are multiple risk factors. So to start with, there's a genetic component. If you have a parent who has a psychological issue, it's bound to percolate into the child, genetically as well as environmentally. So that's one. Second thing that also matters is the environment. The home environment is paramount when it comes to the causation of this disorder. The parenting approach is paramount when it comes into causing this disorder, because the maternal parenting and the paternal parenting have to match. It's very important. You can't have two diverse views. The child obviously gets confused and doesn't know what view to follow. Mother father unrest, violence is another cause which is there. Joint families where there are huge comparisons between children can also, in the Indian scenario, affect the child. Huge parental expectations which are sort of burdened on the young delicate shoulders of the child very often can also lead to these things. Peer pressure in our scenario is very important. Keeping up to peers. He has a new phone, I want a new phone. He has a new jeans, I want a new jeans. So very often keeping up to that peer pressure also plays a very important issue. And most importantly, I think loneliness. We have many teenagers who complain of loneliness, that they don't have anyone to speak to. So that's very, very important. So there are multiple factors that play a role.
Okay. So, the emotional well-being of children, we know, is just as important as their physical health, because good mental health will allow them to grow into well-rounded, healthy adults. But once your child is diagnosed with a mental disorder, we want to know from you, what can parents do to cope with this kind of situation?
Well, I think the first step is take him for a thorough assessment. So, visit a psychiatrist, get a consultation done. If needed, we get psychological testing done. Once the testing is done and the evaluation is done and we're sure, then we probably go ahead with treatment. And the treatment would involve either counseling or psychotherapy and other therapies, or it would involve some amount of medication. Now, not all children need medication, but probably maybe 40 to 50% of children need medication. So there's nothing to be perturbed or worried about psychiatric medication, because it's safe. We're in 2021 nearly, so we have effective medication. We have medications which are all US FDA approved for child psychiatric problems. They've been tried in children. Uh, Parents ask me, are there side effects? I always say every medication has some side effects, but we have to monitor. And when we monitor judiciously, use the drug rationally, we don't see it. So that's something which is my job as a doctor, to make sure that there are no side effects seen. But I think a lot of counseling, a lot of alternative methods like play, dance, music, apart from the rigorous counseling and psychotherapy, play a very important role. You need also a special educator sometimes to look at the individual education planning for the child. So all these things, so you have a team approach that works. Some children may need an occupational therapist, some may need a psychologist, some may need a special educator, some may need all, some may need a speech therapist. So it's a combined approach that plays a role.
Okay, so once the child has been diagnosed, what information should a parent give to the school about the child's need? How do you work with the school? It's important, right?
Yes. So normally what happens is, again, here I would like to state that we have different types of schools. So we have some schools which are mental health friendly schools, as I call them. There are some schools which are, not so open to mental health. So, and I think that all depends on who is the principal and what his or her attitude towards mental health is. So very often, and the class teacher. So I very often tell the parent that if they can arrange a meeting for the principal class teacher together, and if they say need me to speak to them on the phone while I'm there, I wouldn't mind being on a speaker and talking to them, because it's important. So we normally convey to the school that this is what the problem is, and these are a few adjustments to the school approach that we would like. Now some of it may be doable, some of it may not be doable. So then you have principals who are very understanding and accommodating and go out of their way to help a child. You have some principals who just put their foot down and say let him rest at home till he's fine and then come. So they really don't want to make an effort. So you see that also. So I think based on how the principal is, very often we sort of work and whatever. And it's also important to realize that the principal and teacher is more worried. Nothing should happen in the school, nothing should happen in the classroom. The school name has to be protected, so they have their priorities. The parent doesn't want the child to miss school and doesn't want academics to suffer, so they have their priorities. But one thing I must convey here to teachers, parents, principals, educators, that your child's mental health is far more important than their grades. Please remember that.
Right. But I've also seen that there are times that parents don't want to divulge any information to the class teacher or the coordinators. They, either they're in a denial. Even when you bring it to them that we feel that the child may have certain issues, they really don't want. They don't want to talk about it,
See,
and they
there
don't share full information.
there is a huge amount of stigma associated with mental health. So the stigma is primarily with the fact that my child has a psychiatric problem and my child is visiting a psychiatrist. So therefore, when I work in schools, I normally have a chamber, I have an open door policy where any child can walk in and talk to me. Now what happens is I normally visit the classroom and I talk to fifth, sixth, seventh, eighth standard children in rotation, and I tell them what anxiety is, what depression is, so that they are aware. And I tell them, if you have a family member or a friend who's going through this, see that he comes and sees me. And children are our biggest ambassadors, so they very often go home and tell their parents, I feel I am undergoing anxiety and I need to see a psychiatrist. And there's no shame in it, and I'm absolutely fine, and we have a particular doctor in our school who comes, so why not we go and see him? So very often, uh, uh, since they are seeing me in the school, obviously the school already knows. So I serve as a middleman that divulges what the school should probably know and what the school should probably not know. Parents are afraid because they think their child will be singled out, labeled,
Yeah,
troubled,
labeled.
and if his friends come to know, he'll probably be bullied. So these are things which are there. I always remember a very prestigious school which I won't name, but they make children with learning disabilities sit separately for an exam, and they give them a separate colored answer paper which is used for checking, which I feel is the biggest stigma you can do, because everyone comes to know that their child has and a simple thing rather would be to give a list of roll numbers to the teacher, which would help them identify, but they don't want to take the trouble to probably do that.
Okay, we've seen that children feel anxious about different things at different stages of their life. So some of these worries are a normal part of their growing up. Like they have fears and phobias, which is related to insects or height, etc. And these fears go away gradually on their own. But sometimes they have anxiety, which becomes a problem, and it starts to get in the way of their everyday life. What are these signs and symptoms in children which show that there is some issue and we need to be aware of it?
See, children have all sorts of fears. Some
Right.
have fear of the dark, some have fear of ghosts, some have fear of insects, some have fear of blood. So the important thing to realize is it's normal to have these fears. We have to watch how it unfolds as they grow. And
Right.
it's sometimes probably they overgrow it, sometimes it remains. Even if it remains, how much is that fear interfering in their day-to-day life is what matters. And if you find it's not interfering to a large extent, then I think we can
Let
let
it.
it remain. But if you feel no, it's interfere, like for example, fear of a lizard or fear of a cockroach, many people have, and it
Right.
doesn't really interfere in their day-to-day functioning in a very big way. So it's absolutely fine. But yes, if you have a fear of going by bus, it would affect your day-to-day functioning, because then transport becomes an issue. Or if you have a fear, like there are children I know who have a fear of thunder. Now what do? You can't really do much for that. You have to tell them, I mean, get accustomed to that. Well, okay, 4 5 months a year thunder is going to come, and now in Bombay probably 12 months a year thunder is going to
Right.
come, and then after that it's going to probably go away. But that's that. So there are things you have to quantify the fear and see what needs help and what doesn't need help.
Okay. So kids often go through, especially preschoolers, they go through a phase when they're really clingy and they're afraid of unfamiliar places and people. So you please tell us about this most common form of anxiety in kids, which is separation anxiety. Is there a time when you should be seeing a doctor for that?
Okay, now there are two facets to separation anxiety. The first facet is the separation anxiety faced by the child, and the second facet is the
Yes.
separation anxiety by the mother. Both. So I think both, the levels of both play a very important role. So if it's at the level of the child and the mother is strong enough, she can easily help the child overcome that. But I've had more mothers cry at the school gate than children cry at the school gate, and it very often does happen. So I always tell parents that you yourself have to get a bit tough. Few roles are, the child will not be taken home how much ever he cries. He will attend school. And very often we've seen that yes, there is a bit of crying at the gate. The moment he enters school, sits in the classroom, he forgets about everything and things are fine. So it's that initial period. So I remember that there's something that I always tell, particularly preschoolers, and a very small thing that I tell the parents is, and it's a very affordable, doable thing: divert the anxiety. So I say what has to be done is give the child a flower every day and tell him, he has to go to school and give this to his teacher. Now for a small child, giving something to his teacher is very, very prestigious. So the moment he reaches the school, there's a rose given into his hand and he's told to march into the school because he has to go and give it to the teacher. The teacher has to be informed about this and told that this is part of our way to get rid of his separation anxiety. So the moment the child enters the school with the rose, he's diverted from looking back at his mother and worrying about her, and the mother immediately leaves and the child adapts. And we've done this in innumerable number of children, and it has worked because it's a very basic, normal separation anxiety. But you have cases where it's difficult. You have cases where they cry the whole day, they run out of class. At times we've had to make a mother sit with him, make the mother sit outside the class. So all these issues are there, but it's workable. I mean, we have to, it's workable. The anxiety of the child and the parent both have to be managed, and it's very, very workable.
Okay. So sometimes people have these, now I'm talking about the adults, they have sudden attacks of anxiety. And they have that overwhelming fear that lasts for several minutes. So what exactly are these panic attacks?
Well, panic attacks are attacks of intense anxiety that peak in around 10 to 20 seconds, and they may last for around 2 3 minutes to around 15 to 30 minutes, depending on how long they are. So what happens in a panic attack is you feel a sudden rush of anxiety. You begin to feel your heart is racing, your chest is pounding, something bad
Like
is
you're
going to
having a heart
happen.
attack.
Yes, you're having a heart attack, something will happen, your hands tremble, you sweat, you feel giddy, you feel numb, you feel I'm going to fall down unconscious. And you have, it's part of an anxiety disorder that we refer to as panic disorder. And what basically has to be done there is that one option is, of course, there's a medical option for treatment, but the patient also has to be taught relaxation. He's also be taught how to control his heart rate and relax when a panic attack ensues. And most importantly, he has to be taught how one has to sort of play an important role when it comes to the management of these panic attacks, in the sense he has to learn to relax. So yoga, meditation, calming down his heart rate, biofeedback, apart from the medical role, these are important roles. Long term therapy also, to try and ascertain the root cause of anxiety, is also very important. So you don't really only cure the anxiety by just medication.
Hmm. So there must be some ways for people to regain a sense of control when panic strikes. So can you tell us some strategies to stop a panic attack?
Well, I think one of the things is that when you feel it's going to happen, you go and divert yourself into doing something that relaxes you. Second, you deep breathe fast. So that deep breathing fast helps to reduce your heart rate. You may also breathe into a plastic bag or breathe into a cup or breathe into a straw, which probably could help you. And these are things which you could carry with you anywhere. And these are things which, play a very important role, because when you breathe fast into a bag, the carbon dioxide which you breathe out is inhaled again, and that reduces your heart rate and automatically calms down your panic. And you can even practice relaxation in a sitting position. So these are things which you can learn on your own to sort of calm the panic down.
Okay. So all young children we know are naughty and sometimes defiant and impulsive, which is perfectly normal. But some children have difficult and challenging behaviors which are outside the norm for their age. So now we want to ask you about the most common disruptive behavior disorder, which is ADHD. What is ADHD?
Well, ADHD, of course, stands for Attention Deficit Hyperactivity Disorder. And there are three components for ADHD. The first component is inattention or lack of attention. So the attention span is low. Normally, children have an attention span of 25 to 30 minutes or 40 minutes. And in children with ADHD, it may be as low as 1 minute, 5 minutes to 10 minutes, and not more than that. They get distracted very easily. The second component is impulsivity. They act without thinking. So when you act without thinking, it's said to be impulsive. You may push a child who's in a line, you may stand out of line, you may answer out of turn, you may get a little fidgety, you may do things without being thinking of what the future consequences of what you're doing are. The third component is hyperactivity, and hyperactivity primarily involves you being restless, running around, not sitting in one place. Even in the classroom, the child is always out of his place and fidgety. So there are three components to ADHD, and you see it as young as from a preschool level to primary school level. So nowadays we are seeing more and more children in preschool with ADHD, and I think very often what happens is you have to keep one um, ayabai or one helper to be only with that child, because that child is so hyperactive. So very often that happens, and then when they are brought to my clinic also, they aren't sitting in one place and they are very hyperactive. And very often the parents say, no, you have to medicate him, calm him down, because he's like this the whole day and we really can't do anything because we have to always be after him. So these things very often happen. So ADHD needs to be assessed, diagnosed, and once you diagnose it, treated medically, behaviorally, with therapy. So that's what ADHD is. And I think it's one of the commonest child psychiatric disorders. Probably 20 to 40% of children at any given time may have ADHD.
Okay, so the children who do exhibit this ADHD symptoms, I've seen in school, they can't seem to focus on the material that you're working, which very hard to deliver. So what are some strategies that the teachers can adapt or adopt to help children with ADHD to succeed?
Well, I think one is keep him right near your nose. So keep him on the first bench. That's what I say. Keep him next to you. A lot of one-on-one instruction rather than classroom instruction works well. Short, simple instructions and short tasks which involve 5 minutes, 10 minutes of work better. Give him a lot of work to do in the class, like putting the books, rubbing the board, running around here and there, which will also give some vent to his hyperactivity. If if he can't remain in class, put him for an extra games period. That's also very good for his hyperactivity to get some energy venting out over there. Keep him in a place where he can't get fidgety. So we put him on the first row in the corner seat so he can't come out very easily. So these are things which, I mean, we try and sort of do.
I have seen in schools that they give them some break, like a 5-minute break. So the kids used to go out and take a short walk and then come back and then resume what is
See, that used to be done, but then what happens is you have children running around the corridor, which we don't want. So we have something known as a timeout room.
and
So if a child is too hyperactive, he's taken to a timeout room and he's kept there. It's more so that the child learns a bit of discipline. But timeout sometimes can be taken wrongly as a form of punishment rather than a behavioral management. And in today's era, with so many strict laws with regard to how children have to be behaviorally handled, we have to be very cautious before we think of a timeout approach.
okay. Uh, Doctor, children with learning disabilities, they struggle with schoolwork regardless of their intellectual abilities. So, we want to know from you multisensory teaching techniques. Are they useful for dealing with students with these kind of problems like dyslexia, etc.?
Definitely, multisensory techniques are very useful because we have to have children learn all sorts of ways of learning. So, visual learning, auditory learning, tactile learning, learning which involves using all the senses together, seeing a lot, talking a lot, thinking a lot, all is very, very important. And I think it's true for every child, not only a child with learning disability. Any child can learn a lot from this. So, it's very important that you have children who where this approach is used, and particularly when this approach is used, it will probably work well for all children, because some children are visual learners, some are auditory learners, some are tactile learners, so it depends. So you have to see what kind of learning benefits the child the most.
Okay. So, can you tell us what is play therapy? This is a term we often come across, play therapy. And what does a play therapy session look like?
Well, play therapy is a form of therapy where you have a therapy room where there are a large number of games and other activities where a child can enter. He can choose a toy, he plays with that toy. He could play with it in an aggressive manner, he could play with it in a subtle manner. The therapist sits while the child is playing, talks to him, tries to talk to him about what's happening in play. This could be a solitary activity, it could be a group activity with other children, and you try and find out personal information of the child through play therapy techniques.
Okay. So, who are the kind of kids who can be helped by this play therapy?
I think every child can work with play therapy. So, hyperactive children, children who are depressed, children who are anxious, children who are worried, all sorts of children can work with play therapy. So, play therapy is a very useful method and it's underused in India. But I think slowly it's coming off vogue and we are having more and more people use it.
Okay. So now I'm going to take up some questions by our viewers and parents. And the question is, uh, some parents want to know what kind of questions should you ask your children on a daily basis about their school or class?
We'll ask them how school was, how their teacher was, how their friends were, what has been taught, what did they enjoy the most, what jokes did they crack, what did their friends say, who their friends are, where do they stay, and
Right.
you should know about it. I always remember we did a survey of seven standard children where we asked parents to name three best friends of their children and where they stay, and not many parents knew. So it's
Yeah.
very important that you have to be aware of your child's personal life.
Okay. Another question is, how can we make a 3 or 4 year old child feel friendly and comfortable towards their teachers in this new normal digital learning?
Well, I think um, that is a little tough because children may not be very adept at an online platform at that age.
Yeah.
So they would probably need time where they physically meet their teacher one on one so that they know who their teacher is. And then probably after that, see the teacher online. So the teacher can probably meet them one on one, introduce herself, be with them for 10 or 15 minutes, tell her, show them a screen and say, I will be coming to your house every day on the screen to talk to you. And I think that would help.
Okay. So we've seen some schools do that. They do one-on-one interactions, and pretty often they do it. And even they have small group interactions just to get the kids comfortable and to get to know the kid. So
Yeah.
see that. Okay. Now I think coming up to the last question of this show, how will how will you respond? How will I respond when my child struggles in class?
Well, I think the first thing is do not panic yourself. Okay. Do not blame yourself as a parent if he's struggling. Try and find out the cause. No, the commonest problem is that a lot of emphasis is on marks and grades and not on academics. So the moment the child comes and says, Ki, Mama, I've got 18 out of 20 in the test, the first question you ask is, who's got 20 out of 20? Who's got 19? Where did you lose 2 marks? How much did your friend get? But we never really bothered to ask the child, oh, wow, you've got 18. I'm proud of you. But where did you lose 2 marks? Kindly tell me. So that doesn't happen. So focus on if he's struggling, tell him it's perfectly okay to fail. It's fine. Let's now sit and try and find out what have you not followed. Don't
Right.
tell him how come all your friends have followed and you haven't followed. No, don't tell him that. Or don't tell him you must have been probably mischievous, so you didn't follow. No, it's something which I think, I mean, we all have failed in an exam. Parents, always remember, I think, Parminder, we've all failed in some exam in school, some test in our sixth, seventh, eighth standard. No one today asks us, why did you fail in that test? So I think these things really don't matter in the end. I mean, what matters is what we become in life, and I think the values that we put in the and what we probably have carried from school is, I think, the greatness of an exemplary teacher that we had, or the love we got from an exemplary principal, is what we probably carry with us all our lives. I don't think our geography maps and our history lessons are what we carry with us for life, but the way
Right.
they were taught is what we carry. So even today, when if my son says my history teacher is boring, I tell him, I had this one teacher and she was so good, and the way she taught history was so interesting that we felt it was a story. And I actually can probably sit with him and teach him history in the same way. And
Right.
that's what makes the learning more interesting.
Okay. So that was the last question on our show. I do not see more questions. Okay, thank you so much for being on our show, Doctor. We deeply appreciate that you took time out for us to answer some of our questions. We would also like to thank you all, our viewers, for watching. See you next time, and don't forget to subscribe to our channel. Thank you.
Thank you.